Welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock. In this episode, we will address colorectal cancer awareness. Colorectal cancer is the third most commonly diagnosed cancer amongst men and women in the United States. And joining me is Dr. Kevin Moreman, gastroenterologist with Heartland Memorial Health. Welcome.
Good morning.
Let's talk a little bit about what colorectal cancer actually is.
Colorectal cancer is a cancer that involves the colon or the large intestine, which is the end of your digestive tract.
Dr. Moreman, you said it was part of our digestive tract. So what would be the risk factors for colorectal cancer?
There's a lot of different risk factors. Probably the most important one is a family history of colon cancer, in especially a first-degree relative, such as your parents or a sibling. But there's other risk factors that include a personal history of colon polyps. Certain diets tend to be high risk as well. Red meats or a diet high in red meats or high fat contents typically increases your risk of colon cancer.
I had read processed foods. We need to stay away from the processed meats a little bit too. Is that correct?
Probably so. You know, there's a big push now to be more organic, and so many of our foods nowadays are processed and probably have a lot of ingredients we never think of. So there has been a lot of thought whether or not some of those increase your risk of cancer.
I think too with colorectal cancer being the digestive system, obviously maybe weight might have something to do with it too.
Certainly obesity is a risk factor for colon cancer. This country, there's a epidemic of obesity which we've been battling for the last 20 years, and it's not necessarily getting any better, unfortunately, and that does increase your risk of colon cancer too, as does smoking, as do a lot of factors. So
leading a healthy lifestyle, knowing your personal risk factors as far as your risk with maybe inflammatory bowel disease, those types of things, and then also your relatives' history of colorectal cancer, correct?
Certainly. People with inflammatory bowel disease, as you mentioned, they do have a higher risk of colon cancer too. Now those people typically have a lot of symptoms, and as a consequence they're in contact with their doctor, and so they tend to have better surveillance with colonoscopies to screen for colon cancer earlier. But the general population that doesn't have any symptoms or any GI symptoms, those are the people that really need to pay attention and make sure they're up to date on screening and know when they need to have those proper screening colonoscopy.
So screening, I'm glad you mentioned that, and you also used the word polyps. So tell us why it's so important to be screened and what types of tests are actually available for the screening process.
The fortunate part about the development of colon cancer is that by and large most cases tend to start with a colon polyp. By doing a screening colonoscopy, which is a examination where we look inside the colon, we're able to find those polyps when they're very small. And the other fortunate part about that test is that we can take those polyps out during that examination so that that particular polyp won't develop or have the opportunity to turn into a colon cancer down the road.
So is a polyp a type of a growth that could potentially be cancer, and then it goes to the lining, is that correct?
Well, it's a growth in the lining of the colon. And with time, fortunately it's a slow process in most cases, but with time that can turn into colon cancer. And so being able to take that out during a colonoscopy, for example, is a very useful tool in preventative measure that we can all take.
So we use the word colonoscopy. There's also, I think, a sigmoidoscopy. Is that correct too? Tell us what age that needs to start at and actually what that procedure might entail.
The two procedures you mentioned are very similar but a little different. The sigmoidoscopy I would describe as an abbreviated colonoscopy, meaning it does not go as far around the entire colon. It only examines the lower third of the colon. A colonoscopy, on the other hand, involves examination of the entire colon, which is really what most people need to have. And that screening starts at the age 50.
Right. So that actually is, it's allowing the the healthcare provider, the physician, to take a look at what's going on inside our bodies through a very, very small scope, correct?
That is very correct.
And then the prep for that usually is very...
Yeah, the prep is probably the part that people dislike the most.
Right.
You know, you end up having to drink a laxative, spend several hours at home drinking this laxative, but it's actually one of the more important parts of the test. Now, of course, you do that in the comforts of your own home. The test itself is actually very easy. Most people are asleep and don't remember any part of the test itself. Those are some of the obstacles that people, or concerns that people have when having a colonoscopy, because the idea of it itself is not something that anybody would really voluntarily sign up for, which has been some of the challenge in getting people to have the screening, this very important screening test.
And I was going to say, I think that's really what we want to stress, is that the preparation for it, the actual test, does not take that amount of time. I mean, it's just minimal really compared to what you can find in reducing your risk factors.
It is, and I think the more people realize that, the more people would be more inclined or willing to have the test done itself. You know, 30 years ago when we first started doing this type of test, the preparation itself was really pretty rough. And over the last few years especially, those preparations have become a lot easier to do and do well, so that we get a good examination. Unfortunately, some of the ideas that people have about the test have been a little slower to come around. But I think if you talk to most people who've had a colonoscopy recently, they will tell you that the prep itself is not too bad, and the test itself is probably easier.
Well, and I think the prep has minimalized, where years ago it was...
Very true.
It was more days.
The volumes of the prep used to be a lot more than what they are now.
Right. So that being said, you know, really talk to your healthcare professional about what prep is best for you, what your best option is as far as which type of screening, whether it be the colonoscopy or the sigmoidoscopy, you know, for you to get screened.
Absolutely, and starting at the age of 50. Now, there are some people with a family history who may even need a colonoscopy sooner than the age of 50, and that depends on what age their family member was diagnosed with colon cancer. So, for example, if you have a parent that had colon cancer, and for example, maybe they were only 50 years of age when they found it, then that person would need to have their screening colonoscopy probably at the age of 40. So even there are some cases that you may need it even before the age of 50.
So if a person has a colonoscopy at age 50, it's not something we have to do necessarily every year, correct?
Absolutely not. Most of the time we're able to spread that out to several years, 5 years, occasionally 10 years if we get a good examination and there's no excessive or there's no risk factors that would make them higher risk, which is fortunate. You know, it's not a test you have to have every year. If we get a good examination and you're low risk, 10 years would be appropriate for your next one.
Yes, and stressing again the importance of this is a preventative screening for cancer, for colorectal cancer. So,
it is.
You know, as we've talked about the other cancers, this is the specific screening.
It is. The thing about colon cancer is that most people don't have any symptoms until it's very late in the process. Most people don't see bleeding. Most people don't have weight loss. Most people don't have abdominal pain. And so having this type of screening is very important. And it's very common that we see these growths, the polyps that we talked about earlier. It's very common that we see these in very healthy 50-year-old people with no symptoms.
And, you know, talking about the prevalence, I think, you know, starting at age 50, it's probably diagnosed higher because people are getting screened, correct? I think I had read like 9 out of the 10 are diagnosed after the age 50.
True.
So when we look at the prevalence of somebody having this in their lifetime, what's that statistic?
That statistic is actually surprising, about 5% lifetime incidence of colon cancer. So that's 1 in 20 people will get colon cancer in their lifetime. When you break it down to those numbers, that sounds pretty high.
Right. So that encourages us to get our screening and make sure that our risk factors are lower. Dr. Moreman, being a preventative screening, I think it's important that our viewers understand that they might want to look at their health insurance coverage and also Medicare, because a lot of companies now, insurance companies, are helping with preventative screenings.
Yeah, as part of the Affordable Care Act, most insurance companies are obligated to pay for screening colonoscopies, which is really important. You know, most people think of this test, like a lot of hospital procedures, as an expensive test. And now as we all have high copays and high deductibles, that's certainly something that we're more concerned with. Fortunately, screening colonoscopies are covered very well by health insurances now, so that should no longer be an obstacle to people having this test done.
Absolutely. I think a lot of the barriers, as we've been talking about, have been lessened or eliminated a little bit for the accessibility of individuals to be able to get screened.
Which is always the problem with these screening tests, getting rid of some of these barriers, whether or not it be the financial barriers or just getting past the stigmata of the idea of having a colonoscopy. And that has gotten better over the years. But there are still areas of the country where our screening rates are less than 50%, and that's gotten better. The fortunate part is we know screening works. In the last 20 years, the colon cancer deaths have gone down every year, and that's in large part due to the screening test. So we know that it works. It's just a matter of getting people to come and have the colonoscopy and get over some of those hurdles that we talked about.
Well, and going back to the prep, as we had talked about too, the importance of actually doing the prep so that you have the clean colon to be able to take a good look at what's going on.
Right. When you come to have a screening colonoscopy, for example, in my office, the nurse will walk you through those instructions. They're all written down for you because we want you to understand those directions properly so that you do get a good exam. The last thing we want you to have happen is to go through the bowel cleansing process and not understand it or get confused and not get a good exam because of that. So that's something that we explain to the patients, and we walk them through that. And we get a lot of phone calls sometimes the night before when somebody's taking the prep and not sure, but that's what we're there for. That's what my staff is there for, to help you get a good examination.
Right. Now, we've talked about the screening, the fact that people have anesthesia, so they don't remember actually the screening process and are back pretty much to their normal lifestyle rather quickly.
Most people go to work the next day. That's a frequent question that people ask me. Most people miss one day of work, so you can go to work the day before and go to work the next day after an examination like this. And most people don't. In fact, almost nobody remembers the examination itself.
You're pretty much back to normal. Start eating slowly your regular diet, and you're good to go.
Yep.
Right. And we hope again that's a healthy diet. We want to reiterate that as we talk about prevention tips, that it's real important to make sure, of course, you have a diet that's high in fiber, low in fat, that you're making sure that you're exercising. These are all preventative tips for colorectal cancer.
Absolutely.
And we talked also, I think, about smoking, that we should not do that too. So
well, smoking has so many bad outcomes, and fortunately smoking, we've been able to cut down on the rates of smoking, but most people don't attribute colorectal cancer to smoking directly, but certainly it is a risk factor for it, along with obesity and high-fat diet and those kinds of things.
And the lack of activity, and then also the fact that you want to look again at your personal risk factors, what you're doing with your lifestyle habits. Talk to your healthcare professional about what's best for you and when to get screened. Well, Dr. Moreman, we appreciate you being here with us today and sharing this important information. Again, we hope that you take the opportunity to look at your personal risk factors, your lifestyle habits, and talk to your healthcare professional about when it should be your time to get screened for colorectal cancer. For more information, we invite you to go to www.hmh.net and hope you tune in next month for another important edition of Health in the Heartland.